heart attack risk doubles after 65, unless you follow this. Did you know that the risk of heart attack doubles after age 65? This isn't fear-mongering. It's an undeniable statistical reality. However, there's a crucial aspect that many people completely overlook. The problem doesn't lie in the natural aging process itself. The fundamental issue is in the decisions we make daily once we reach this age. The majority of mature people don't understand how their daily routines affect heart function. The encouraging news? You can take control of the situation immediately. In this content, we'll reveal the 10 most effective strategies to safeguard your cardiovascular system and potentially extend your life. They don't require complex skills or substantial investments. In reality, most of these practices can be implemented in the comfort of your home without resorting to medications. However, the first strategy is the most undervalued of all and could literally preserve your life. Therefore, if you're over 60 or care for someone in this age group, this could be the most significant content you'll watch this year. 10th place, maintain adequate daily hydration. Poor hydration might seem unrelated to heart problems, but it actually represents a significant risk factor. When water intake is insufficient, blood consistency becomes denser. This condition increases heart strain and amplifies the possibilities of blood clot formation. Many elderly people reduce liquid consumption due to lack of thirst or to avoid frequent urination, creating a risky situation. The cardiovascular system needs optimal hydration to effectively distribute blood throughout the body. Viscous blood promotes the accumulation of arterial deposits and blood pressure elevation, both primary triggers of coronary events. Aim to consume 6 to 8 portions of liquids daily, increasing in case of sweating. Don't wait for the sensation of thirst. Transform it into an established practice. Start every day with a portion of water and distribute consumption throughout the hours. If plain water seems monotonous, experiment with natural teas or add elements like citrus fruits. Maintaining fluid balance not only protects the cardiovascular system, but also supports kidney function, mental clarity, and joint health. It represents a simple practice that generates enormous benefits, particularly relevant after age 65. If urine shows an intense yellowish coloration, it's time to increase fluid intake. Protect your heart. Never neglect your daily water needs. 9th place, completely eliminate smoking, including passive exposure. Even sporadic smoking can be lethal for mature people. Tobacco hardens arterial walls, raises blood pressure, and overloads heart activity. At 60 or 70 years old, blood vessels already present greater fragility. Adding smoke creates the ideal combination for a coronary event. There's an aspect that many elderly people underestimate. Even when quitting decades ago, some negative effects persist. However, stopping immediately still offers opportunities for heart recovery. Within a few weeks, blood pressure values begin to normalize. Within a few months, circulation improves, and the danger of cardiovascular diseases decreases considerably. Even for non-smokers, staying with smokers still involves exposure to risks. Transform your home and vehicle into completely smoke-free environments. If you're trying to quit, consult your doctor or participate in support programs. There are no time limits to start. Abandoning tobacco represents the optimal choice for heart, lungs, and brain. You'll improve breathing, increase strength, and extend your life. Protect your future by permanently abandoning smoking. If this content is proving useful to you, I warmly invite you to support our channel by liking, subscribing, and activating the notification bell. Every week, we publish valuable content specifically designed to improve the quality of life for mature people. Your support allows us to continue sharing these tips that can truly make a difference in your health. 8th place, Dedicate 30 minutes daily to body movement. Your heart functions like a muscle and strengthens through constant use. Physical activity represents one of the most effective defenses against cardiovascular diseases, especially after age 65. Strenuous workouts or gym memberships aren't necessary. A simple half-hour daily walk can decrease blood pressure, reduce cholesterol, control blood sugar levels, and enhance circulation. Movement prevents the formation of blood aggregates and strengthens heart pumping capacity. Walking, swimming, practicing yoga, tai chi, or dancing all represent excellent choices. The fundamental element is regularity, not intensity. Avoid prolonged periods of sedentary behavior. Stand up every hour, perform stretches, walk through domestic spaces, or do some light bending. Physical activity also improves mood and sleep quality, reducing heart stress. In the presence of joint pain or balance problems, start with seated exercises or ask your doctor for guidance on safer options. The worst choice is complete inactivity, so start gradually, but start immediately. A stronger heart begins with a single movement. Increase activity, reduce sedentary time, and provide your heart with the training necessary to keep you vital and active. 7th place, reduce sodium consumption and processed foods. Excess sodium represents a silent killer, particularly for mature people. Salt causes body water retention, increasing blood volume and heart pressure. Over time, this raises blood pressure and thickens arteries, two main causes of heart attacks. After age 65, kidneys lose efficiency in eliminating excess sodium, further worsening the impact. The problem? Sodium hides in unexpected places, like packaged broths, frozen foods, condiments, and even baked goods. Keep sodium intake below 1,500 milligrams daily, equivalent to about 2/3 of a teaspoon. Carefully examine nutritional labels. Select reduced sodium versions of your favorite foods. Replace table salt with beneficial spices like garlic, basil, or turmeric, and avoid chips, pickles, and packaged snacks. Instead, prefer whole foods, fresh vegetables, fruits, and homemade preparations where you can control salt content. Your heart will be grateful. Reducing salt doesn't mean flavorless meals. It simply means making a fundamental choice to protect your life. Remember, taste buds adapt within a few weeks, but cardiovascular benefits can last a lifetime. 6th place, perform regular heart screenings. Feeling good doesn't guarantee that your heart is also healthy. This is why regular checkups are so crucial after age 65. Many mature people don't realize they suffer from hypertension, elevated cholesterol, or silent heart damage until it's too late. The doctor can identify early warning signs long before symptom manifestation. Monitor blood pressure every few months, especially if you take medications. Request annual blood tests to check cholesterol, triglycerides, and blood sugar. If you present elevated risks, perform an electrocardiogram or stress test. These exams can reveal obstructions or heart arrhythmias before they can cause a heart attack. Don't skip checkups just because you feel fit. Prevention is much simpler than treatment. Regular checkups help you and your doctor stay one step ahead. They also guide your diet, lifestyle, and therapeutic choices. A simple exam today can prevent a medical emergency tomorrow. Be proactive, stay informed, and never underestimate the power of routine checkups. They could save your life. 5th place, decrease emotional tension levels. Stress doesn't just represent a mental burden, but a true heart killer. Chronic tension elevates cortisol and adrenaline levels, which increase blood pressure, constrict arteries, and progressively weaken the heart. Mature people often face hidden tension from isolation, financial worries, or health problems. If not managed, Tension can trigger inflammation, sleep disorders, excessive eating, and even heart arrhythmias. What can you implement? Start integrating relaxing habits into your daily routine. Deep breathing, meditation, or simply sitting quietly with a warm beverage can generate an enormous difference. Try 10 minutes of stretching or a walk in natural environments. Talk with a friend, listen to relaxing music, keep a gratitude journal. Even small rituals help the nervous system relax. Avoid stressful conversations in front of television or phone before nighttime rest, and don't keep everything inside. Talk with someone you trust. Your heart and mind are deeply interconnected. When you calm your thoughts, you protect your heart. Tension can be invisible, but its damage is real. Transform peace and relaxation into a daily habit. Your heart needs it more than you imagine. Fourth place, monitor blood sugar. Even without diabetes, elevated blood sugar levels represent a significant risk for heart disease, particularly after age 65. High blood sugar damages blood vessel lining and facilitates plaque formation, causing arterial obstruction. Over time, this increases the risk of heart attacks and strokes. Mature people with type 2 diabetes or insulin resistance are particularly vulnerable. This is why it's fundamental to regularly monitor blood sugar, especially in the presence of fatigue, excessive thirst, or blurred vision. Follow a balanced diet, low in added sugars and refined carbohydrates. Replace white bread and sugary drinks with whole grains, leafy green vegetables, and fiber-rich fruits. Portion control is also crucial. Don't overload your plate. Include healthy fats and lean proteins to stabilize blood sugar. Walking for 10 to 15 minutes after meals is recommended. It's proven to lower glucose levels. If you take medications, follow them exactly as prescribed and always consult your doctor before making changes. Keeping blood sugar stable not only prevents diabetes complications, but also helps the heart remain strong, clean, and protected from deadly attacks. Third place, control cholesterol. Elevated cholesterol represents one of the main silent causes of heart attack after age 65. It gradually obstructs arteries with deposits, reducing blood flow and increasing blockage risk. Worse yet, many people don't even know they have it. After age 60, the body no longer manages cholesterol effectively, so even moderately fat-rich diets can lead to high LDL levels, the harmful cholesterol. To protect your heart, check cholesterol annually. Try to keep LDL below 100 and HDL, the beneficial cholesterol, above 60. To lower cholesterol naturally, avoid fried foods, red meat, and whole dairy products. Instead, consume oats, nuts, olive oil, fatty fish like salmon, and abundant fruits and vegetables. Add flax seeds or chia seeds to your diet. They're rich in fiber and omega-3s. If diet isn't sufficient, your doctor might recommend statins or other medications. Don't ignore them. Managing cholesterol equals cleaning your heart's pipes. It keeps blood fluid, reducing the risk of a deadly heart attack. Second place, control blood pressure. Indeed, hypertension is known as the silent killer for a specific reason. It damages heart, arteries, kidneys, and even the brain without any evident symptoms. After age 65, blood pressure tends to increase naturally, making monitoring and control even more important. Try to keep blood pressure below 120 to 80. Any value above 130 to 80 increases heart attack risk. Use a home device to monitor your levels daily or weekly. If it remains elevated, consult your doctor. Don't ignore it. Reduce salt intake, lose excess weight, regularly practice physical activity, and decrease alcohol and caffeine. Stay calm during stressful moments and breathe deeply. Even a single elevated reading doesn't mean disaster, but repeated spikes can cause permanent damage. Remember, High blood pressure doesn't cause pain until it's too late. Controlling blood pressure represents one of the simplest ways to protect your heart and avoid hospitalization. Make it part of your weekly routine. Knowledge represents power, and in this case, saves lives. First place. Act daily, not sporadically. The most important aspect you can implement to reduce heart attack risk after age 65 is this: being consistent. Taking care of your heart doesn't mean making occasional changes or consuming healthy meals sporadically. It's about daily habits that accumulate. Every time you avoid salt, drink water, take a walk, check your pressure, or refuse sugar, you're choosing life. Heart attacks don't occur suddenly. They develop slowly, through years of small harmful choices. But the positive news? You can reverse damage the same way, one choice at a time. No supplement or doctor can help you if you don't personally commit. This means planning your meals, staying active even when you don't feel like it, showing up for checkups, and saying no to excuses. Your heart is aging, but aging doesn't mean giving up. It means being smarter, more aware, more dedicated. The primary method to protect your heart isn't a secret. It's your daily discipline. Start today. Your future self will thank you. So here are 10 powerful habits that could protect your heart and extend your life after age 65. Remember, heart attacks don't occur suddenly. They develop silently through small daily choices. But this also means you can reverse risk the same way, adopting smart and consistent measures every single day. You don't need sophisticated treatments or expensive supplements, just real and simple changes. Drinking more water, moving, reducing salt and sugar intake, managing stress, and regularly checking your values. These aren't just suggestions, they represent your defense against a future cardiac emergency. If this content has been useful to you, please like, subscribe to our channel, and activate notifications to never miss another life-saving health video. Take care of your heart health today, because your best years may still be ahead. Be strong, be smart, and take care of your heart. I would love to hear what you think in the comments below. Subscribe to the channel and activate the bell so you don't miss any content, and thanks for watching this video.